Good afternoon, patients. Today I would like to discuss a new EHR system that we will be implementing at this hospital. I'm going to go over a few benefits that this system is going to offer. Um, a few other benefits will include just clinical benefits, educational benefits, and a few other things that I would like to discuss with you all today. I really want to get you all familiar with this EHR system because not only will the doctor or the physician, nurse, or nursing assistant will be using this system, but you all will be using this system as well at your own use. So just for clinical purposes, so for example, with this system, one of the number one things is to protect your information, and HIPAA is so important in the world today. And as you know, IT professionals or health informaticists, even physicians, our job is to keep you all protected, keep your information protected to make sure that your information does not get in the hands of anyone that is not supposed to be. So, with that being said, this system will do just that, and will make sure that your information is protected, and also make the healthcare providers and other healthcare professionals' life easier when managing the care of you all, as well as just being able to have easier access to you all's information when needed, because a lot of systems um, don't synchronize. So, for example, um, a lot of IT professionals are working to make sure that when you all are going to other hospitals or other clinics that aren't in the same state, or I mean, sometimes you even close by, it's getting a little hard for other physicians to be able to have access, but that's a whole nother subject. But overall, this electronic thing is going to make it easier to transport your information and to make sure that you have easier access to your information when you need it, because we all believe that, when the patient is more involved in their health care and in whatever they're facing, it allows them to want to, jump on the wagon with taking care of themselves better. So we really believe that this system is really going to help you all just as much as the healthcare providers. So it has a really big impact on the clinical aspect. Because we also have a thing like computer on wheels. So with that, we're able to carry different devices into your room instead of having this big clipboard and paperwork fumbling all over the place, trying to write down what you're saying. We're able to carry this device, whether it's in a computer on wheels, or if it's a laptop or a cellular device, or it's an iPad or tablet. We're able to just key in that information, and it's able to go straight to the portal, instead of being able to have to go back later to document this information, and you could possibly have forgotten about what the patient said or so. Really, these electronic devices really will help us. Um, and most importantly, we're going to make sure, and we don't want you all to even have to worry about these electronic devices getting in the way of the physician or healthcare providers, or any other healthcare professional. We don't want you all to think that these electronic devices are going to get in the way, because they're not. They really are going to really pinpoint in helping you all in your healthcare. So, for example, for educational purposes, so say for instance you come in and you have lab work done, and say you don't want to have to come back up to the hospital. Well, we're going to make sure that you all have the access from your home. But it may sound scary, but we're going to try our very best to make sure that your information is protected, even though the same you're not under the same you know um, Wi-Fi that we may be using. Even though it's at home, we're going to try our very best to make sure that your access is still secure, even though your information is still secure, even though you're not on, under our sorry, I can't think of the word, but even though you're not under, you're not at the hospital accessing it, you're at home, we're going to still try our best to make sure that, you're still secured. But yeah, so you're going to be able to access your lab results, or different, things that you may have done, or, different information that you need when going to another clinic. It's easier to just say, hey, I have it on my phone, whereas, having to wait to stuff get faxed over, or however it's getting over to that next clinic. We get very frustrated just waiting on our information to get over and stuff. So it's so much easier to really just have it there in hand, and just, be able to give it to the doctor and feeling more involved. So for example, not having to say, well, I'm not feeling as involved because, I'm not, giving them my information, or I'm not seeing anything, So you're able to just go online and just see what your lab results were, that, whenever they become available, or, and so yeah, so our job is really to just really take, help you all get in, more connected with your healthcare. And most importantly, these systems are going to help the doctors take better care of their patients, because, it's going to help them in ways that they haven't even imagined, they've never imagined. So, when they're in the room taking care of you all, instead of having to, jot down here, jot down there, it's going to be so much easier, just really having better access, and providing tips and tools in different ways, and different things to suggest for you all, instead of the provider having to always think of everything that they need, to take care of you all. So yes, it may be nicks and twicks along the way. Yes, you may run into different problems, or sometimes the internet or server, or, wherever you have it, may be down, but, we will always try our very best to make sure that, things get back up and running as soon as possible. Um, so yeah, so we're definitely excited to present this to you all, and we believe it's going to be a great asset, not only to, this hospital, but to your lives. So I really think it's going to get a lot of people more involved, and really allow them, to want to learn more about, what it is that they have, if they are facing a disease, or even something super small, or keeping tabs of their blood pressure, or what it was last time when they came into the doctor. So I really believe that this is really gonna, be um, that extra, you know, where do you have it? Be whatever you need it to be, to keep track of whatever you need to be, because we're always losing paper. It's harder to keep up with a piece of paper, it ages and stuff. And yes, things happen to electronic devices as well, but it's easier to have easier access to electronics to get to your information that you need. So with that being said, is it any questions that you all may have? And yeah, so we're definitely going to be here to walk you all through the steps, and we're going to be very patient through this process and walk everyone along with it. So thank you so much.